everyone, this presentation covers Chapter 8 on Case Series in the third edition of Jacobsen's textbook, Introduction to Health Research Methods, a Practical Guide. In this chapter, you will learn that a case series describes a group of patients who have the same health condition or who have undergone the same procedure. Here is an outline of the chapter. Section 8.1 is an overview. Section 8.2 goes over some case definitions. Section 8.3 goes over data collection. Section 8.4 covers ethical considerations, and Section 8.5 covers the analysis. Section 8.1 overview. So a case series really must stem from a case report, and so these are just two different types of ways of describing cases. A case report is a description of one patient, whereas a case series is a description of a group of individuals with the same disease or disorder or who have undergone the same procedure. Figure 8.1 goes over some key characteristics of a case series. So the objective here is to describe a group of individuals with a disease. The primary study question could be something like, what are the key characteristics of the cases involved in the study? As far as population goes, it would include all individuals included in the study that have the same disease or disorder or undergone the same procedure. So you don't want to be comparing in a case series. You're just describing this one population. When you may want to use this approach would be when a source of cases is available but no comparison group is required or available. A requirement of this design is to have an appropriate source of cases available. Some of the first steps and things to think about are to specify what new and important information the analysis will provide. You need to identify a source of cases, assign a case definition, and select the characteristics of the study population that will be described. Something to watch out for, though, is the lack of generalizability. So you're just describing this one group of patients. It may not be generalizable to others. And a key statistical measure for this really is just general descriptive statistics. So we'll go over some of that towards the end. Section 8.2 goes over case definitions. And so whenever you have a case series, you have to have a specific definition of what patients are considered cases. The case definition is a list of inclusion and exclusion criteria that must be met for an individual to be classified as a person with the disease of interest in the study. So you want to write down this case definition and make sure that it clarifies what constitutes the disease or disorder. It could also be a specific sign or a symptom. A sign being an objective indication of disease that can be clinically observed, such as a rash, a cough, a fever, or elevated blood pressure. Or it could be some sort of symptom, like a subjective indication of illness experienced by an individual, but cannot be directly observed by others. You could also use something formalized, such as the International Classification of Diseases codes, so the ICD-9, ICD-10 codes, and these could be set aside before if you're looking at medical charts to see what has these specific codes. Another form of those billing codes would be the Current Procedural Technology or CPT codes. Or you could just simply look epidemiologically and look at the person, place, and time characteristics of patients in order to frame that case definition. So figure 8.2 goes over some sample case definitions. And so I'll just go over the first one here, and then you can go over them in your own time. So let's say we have a disease or procedure, and for the first example we're looking at whooping cough, and your person here is anyone that has a confirmed case of whooping cough and it has lasted a certain amount of time. Then for the place, it's looking very specifically at people who live in River City with a diagnosis that was reported to the River City Health Department, and the diagnosis here was using the ICD-10 codes for it. And then it has a very specific time of when these coughs were treated and whether the patient sought medical care during that time. So these are all just things that you need to include for a case definition. Section 8.3 covers data collection for case series. And data collection typically is done either by interviewing cases about their experiences by using a questionnaire or qualitative techniques like an interview with them, or extracting data from the medical records. Section 8.4 covers ethical considerations, and this is really just to reiterate the importance of protecting patient privacy and obtaining permission before using their information. Section 8.5 covers analysis, and so most case study reports do not require statistical tests beyond simple counts of like the frequency, maybe the number of individuals that have the disease, or the percentages. Sometimes they may be used, though, to compare different subpopulations of cases or even a before and after test. But usually a case series is pretty basic. Now, a case series can also be used for looking at mortality. And so you can have a case fatality rate. This is the proportion of people with a particular disease who die as a result of that condition. So I recently finished up a project that's currently under review, looking at the case fatality rate among Arab Americans from COVID-19. And so in order to make those calculations, you have to have the number of people with COVID-19 and then the number of people who died from COVID-19 who had a case for it, who were positive for the disease. But then you can also calculate more broadly mortality rate, which is the percentage of members of a population who die from any condition, which is called an all-cause mortality rate, or it could be very specific, and that could be a death from a particular condition or a cause-specific mortality rate during a specified period of time. Then there is also a proportionate mortality rate, and this is the proportion of deaths in a population during a particular time period that were attributable to a particular cause. So figure 8.3 goes over these calculations in a little bit more detail. And here you can see here in this box on the left, this is the total population. So let's use the project that I did in Michigan. And if we're just looking at mortality among Arab Americans, and specifically looking at it from COVID-19. So this population for this study was just Arab American cases that live in Michigan. Now the people with the disease, if that's this box right here, those are the Arab Americans who had COVID. Then this box right here are all of the deaths. So all of the Arab Americans who died during a specific period of time, regardless of what the cause was. Now this gray shade here are the individuals who died during that period who had COVID-19. So then when we look at mortality rate here, this is just all the deaths. So if we were looking at Arab Americans in Michigan, it would be all of the deaths, regardless of what caused it. Then, if we were looking at the proportionate mortality rate, we would be looking at deaths from disease X over all deaths. So we would be looking at all of the deaths from this disease over all of the deaths here. So we're not really including these people in this box here. It's just deaths from COVID over all deaths. Case fatality rate here is looking at the deaths from disease X and then the people with disease X. So there you're looking at the people who died from COVID among the people who had COVID, which is different from this, which has the deaths from COVID over all of the deaths, which includes everything else. So hopefully that is a good example of how you can calculate the different mortality calculations here. And they're all just very basic division with the numbers of people. So that is it on Chapter 8 on case series. Thank you for listening.